Can you hear me?
Good day, Yana. Thank you
Good
for
day.
suffering through a hangover to join me on.
That's what friends are for.
Well, and you got your coffee going, so you're ready.
Yeah. And look at my mug. It says, wake up, hug cat, hustle.
It's funny because that mug 5 years ago would have said dog instead of cat.
It can be both. I'm going to
It can be
make
both. You guys need to get a house ASAP so you can have the dog.
I know. That's the next step.
Because you might be a cat person now, but
I can't say that. I'm a both person. I don't discriminate.
you're a cat person now because you literally don't have a dog. But we
Yeah.
both know, truthfully, you are a cat dog person or a
I
dog.
am definitely a cat dog person or a dog cat person. But I have that parasite, man. Ari gave me that parasite where I love cats.
Yeah,
thing.
no, it's a deadly virus and parasite and bacteria all rolled into one.
I'll take it.
So tell me, what is going on in your life? How's work given what you do? But first tell everyone what you do and then tell me how the situation that we are in has affected what's going on.
So I'm an RN. I actually changed jobs in the midst of this pandemic. So I'm still helping out my other job. So I was a nurse manager at an RCFCI facility in the Castro. It's a small 15-bed respite/hospice facility, and all my patients have HIV/AIDS. They're all living below the poverty line. Most of them were experiencing homelessness. There was a lot of mental health issues and polysubstance use disorder. And I was at that position for almost a year and a half, and on call 24/7, very stressful. So I've been wanting to make a change for a while, and then the pandemic hit. So I had to switch gears real fast, and I had to implement, a disaster pandemic planning in a facility. So that was a beast of its own, because not only am I in charge of this whole facility, this is something new for everybody. So nobody knows how to smoothly navigate. There's no protocols in place for something this spreadable. So
so given the fact that viruses and pandemics seem to happen with relative frequency, how is it possible that healthcare facilities did not have some sort of contingency plan in place for something like this to happen? Because it seems like every 5, 10, 20 years, with varying levels of severity, there seems to be, whether it's Ebola or SARS or MERS or avian flu, which wasn't very transmittable but was very deadly in its own right. But just in general, you see these things happen with relative frequency. How is there no plan in place? How are we caught in the mud in this?
Yeah, so that's a good question, and that's something that I was asking myself over and over again. This particular facility, as special and lovely as it is a baby nonprofit, and with that comes wearing a lot of different hats for a lot of different people, and your time is really cut thin. And you have every day you have to kind of put the fire out on something, right? You have your schedule and you have your goals, and then I have a patient that's overdosing, and then I have a patient who's running amok. So things get lost in the trenches, and if it's not an immediate threat in front of you, I'm not going to be like, oh, let me think about what if something like this happens. Although, yes, that is a priority that should have been thought of, but it wasn't in place in this facility. But, of course, there are droplet precautions and airborne precautions, and those things, yes, we have a protocol for. But something like COVID is so new. We're still trying to figure out exactly what symptoms, exactly what to do. And it was a process getting it off the ground. So we worked with a baseline of airborne precautions, droplet precautions, right? Isolating, all that stuff. We're also dealing with patients who don't have problems listening to authority figures in general. It is an absolute struggle to contain them. We are a harm reduction clinic, which means that most people use some sort of substance. They can do that. We're not a rehab. They can do whatever they do at will. They just can't do it inside of our walls. So keeping a group of people that have friends on the outside, that spend a lot of time outside, inside during lockdown was incredibly challenging. We can't keep them there physically. And I've been, I was on the phone talking to the Department of Public Health in San Francisco for a long time, and really just begging them to make it more mandatory for our facilities to make this lockdown mandatory, but we can't. This is their home. So I think that was the biggest struggle, is how do we keep these people safe? How do we keep the staff safe when it's it's low on the priority for them? We did have a scare at the facility as I was leaving. One of our residents was in close contact with somebody who confirmed positive for COVID. So I remember it was like, of course, Friday night at like 4 p.m., like right as I was getting ready to leave, I get a call from this infectious disease doctor, be like, hey, this resident in your facility, so-and-so, has been in contact with this other resident that we have in general who is now positive. Like, oh boy, here we go. Let's scramble some things together, right? So immediately, I had to talk to them, like, look, you have to self-isolate. If you are caught leaving your room, we have to discharge you from the facility, which we don't want to do for anyone's safety. But, I just try to explain it and try to, there's a fine line between instilling fear and educating, right? So you want people to realize how severe and how real this threat is. And at the same time, you don't want to elicit panic, because when people are panicked, they tend to, their heads aren't on straight. They tend to do things in a separate way. So that was a delicate thing. And especially when you're dealing with people who have a lot of trauma in their lives, you want to be very delicate, but strict and firm about it. So thankfully he was complacent and followed my instructions. It was hard keeping the other residents in place. We had to, COVID test everybody, staff, residents, keep everybody kind of isolated in their rooms until the first batch came back. And then afterwards, as much as possible, encourage that everyone had to wear masks, of course, when they're not inside their rooms, which were private rooms, by the way. So we got lucky in that sense, at least. But it was scary, because we talked, like, what if a staff member had it, and then we had to shut down the facility? Where would the patients go, right? We had to diverge. So there's a lot of things that were uncertain. And now that we are in month, is it 5 or 6 or however long, whatever's going on, right? There's still, we realize this is here to stay. This is our new reality, right? So how do we kind of stay safe, and still maintain whatever normalcy we can? Because we've seen mental health issues just completely spike up, right? People are more anxious, more depressed, they're using substances more. There's more than just a physiological risk with this virus. It is ruining people's livelihood. And, as much as possible, we educate and we sanitize and do what we need to do, but we have to focus on the whole picture, because this is here to stay, and we can't put our lives on hold for that much longer.
What would you say, outside of medical treatment specifically, what would be some things you advocate for the average civilian in order to help themselves be more, not just physically healthy, but mentally healthy when it comes to dealing with these types of situations? Because I know that there are a lot of folks out there that, like, I've seen that although bars are closed, alcohol sales are up in general. Yep. So people are obviously trying to find ways to self-medicate, because at this point, turning on the news, opening a newspaper, reading a magazine, watching the television, all you're going to see is, I don't want to use the word fear-mongering, but in some ways that's what it's done. Is anytime you turn on the news, you are bombarded with a new, outbreak of this virus somewhere, and all of the cascading effects that happen thereafter. So what are some things you think as a medical professional are useful for helping people maintain some sense of sanity?
That's a great question, and something that I've been really trying to brainstorm for a while now. Obviously, therapy isn't affordable for everybody in this country, in this healthcare system that we have, therapy that should be available literally to everybody is incredibly expensive. So that is not a viable resource for everybody. Um, Support is necessary, and those of us that have a network of friends, I would encourage people to reach out, even if it's somebody that you haven't talked to in a long time. Just a simple text, hey, how are you doing? Just to build a sense of morale that, people, especially introverts, right? They tend to isolate a lot more, and now it's a lot easier to retreat back into the safety of their mind and their home, and they don't have to navigate through social situations as much anymore. So really check in on your introverted friends. But for us, I think, when we're kids and we have all these hobbies, and life is a lot more exciting in a sense than when we're adults and we get into our routines and it's just work and home and family and blah 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 blah. As great as that is for some of us, it seems to we I know for myself, I lost some hobbies, right? So my husband Julian's a teacher. He's been at home for 5 months, and he used to love to draw. So I bought him some pastels and sketch papers. I'm like, hey, instead of like being on your phone and reading about the world at large, and obviously it's more than just this pandemic. It's it's a whole social restructuring that's going on. Then there's a lot of shit going on in the world that is very important and necessary, but it's a lot. So that mixed with the very real danger of the pandemic, it can be very deadly and detrimental to somebody's mental health. So just focusing on getting back to what made you happy as a kid, whether it be drawing or making music or reading books, writing, journaling is very good. Try to journal 5 minutes a day. How was your day? What did you like about it? What didn't you like about it? What do you want to do tomorrow? Just try not to keep your mind stagnant, which is easier said than done. That, and get vitamin D. 5 minutes of just being out on the porch or whatever a day not only makes a difference physiologically, like you need vitamin D for energy and for your serotonin and everything to be up and running.
Well, it's
But
basically like a hormone, isn't it? Like the way that it acts
yep,
within your body is it's effectively a hormone. And it's also important to take vitamin D. I mean, if you can't get it from sunlight, you need to take a supplement, because vitamin D is how your body regulates calcium and phosphorus. And without,
exactly.
without that, and and maybe you can verify this for me, but I've seen that in most of the severe cases, people are at best vitamin D insufficient, and in most severe cases they are vitamin D deficient, which means they are several standard deviations away from even being insufficient. So maybe you can talk on that a little bit, and why it's important for people to start really considering things like exercise, being out in the sun, taking vitamin D, making sure you're getting enough sleep. Because I feel like we are getting a lot of these messages from media saying, wear a mask, don't go outside.
Right,
When in reality, it seems like this virus is not heavily transmittable when it's in outdoors, and it doesn't do well when exposed to sunlight specifically, and
right.
some variations of, you know, incandescent lights and things like that.
Mm-hmm.
So what would you say to people that are wondering what they can do physically at home to keep themselves safer, or to give their bodies a better chance at dealing
Fighting.
with this possibility if they happen to encounter COVID?
That's super valid. Yeah, you're absolutely correct on vitamin D. And I would say at least 60% of well, this is statistics based on what I've come across in my patient population across the years, but at least 60% of people are mildly deficient in vitamin D. And you don't have to take supplements for it. Sunlight, mushrooms, really a lot of it comes from nutrition. Mushrooms are the biggest providers of vitamin D. So if you don't like mushrooms, get some sunlight. Um, but yeah, that is incredibly important to keeping you regular and happier. And sleep and exercise are huge. And that also ties into, there are certain days where you wake up and you're like, I don't feel like doing much. I feel like being a lazy bum. That's okay too. Don't be too hard on yourself. We're not saying to exercise every single day, but to keep heart healthy and mentally healthy and everything. 3 times a week, just walking out. And you're absolutely right. We can't be afraid to be outside in the world. It's as long as we're being safe and we're wearing a mask, we should be outside for daily walks or whatever. We need to get back to normalcy in some capacity.
Where do you see this heading?
It's a great question. Even with the vaccine, I know Americans are, what was it, like 40% of Americans were anti getting a vaccine,
Well, at
regardless.
least 40, I read at least 40% were not going to get a COVID vaccine.
Right.
And, okay, free country, do what you want. But then maybe consider getting an injection of plasma from someone who has antibodies if you don't want to get the vaccine, like something, man. Because if we don't reach some form of herd immunity, which is, I think, for this particular virus, because of its efficacy in spreading, more so in closed areas, like in tight-knit communities, it needs to be somewhere in the realm of like, 70 or 75% in order for it to be considered herd immunity. Whereas, with the disease like measles, it needs to be like 90 to 95% because you can just sneeze and then someone can walk in that room 2 days later and catch measles.
Exactly. Absolutely right. Absolutely right. I don't know where I see this going. I know that it is something that is here to stay. I think most people are going to end up being exposed at some point. And the thing with this disease is it's so unpredictable, right? Like, it's changed its course so much just in the last few months that we've noticed it. We have now healthy people with no comorbidities experiencing severe cases of COVID, and children might be next. Like, we don't know. It's too unpredictable to really know anything. But maybe we're just all gonna get eradicated as a species, and cheers to that. Just kidding.
I mean,
hopefully not.
It seems like with people's desire to all of a sudden become constitutional scholars, especially when it comes to their freedoms in America,
right,
that kind of seems like the direction that we're heading in. And this virus is still so new. It hasn't really had a chance to make a significant change in its ability to infect or cause further harm. And even folks that are asymptomatic or folks that have recovered, there have been at least anecdotal stories that their hearts and lungs have been severely affected after the fact. So even if the mortality rate is only 1% or 2%, that's just who's dying now.
Right.
We can't even imagine 10 years, 20 years down the road. Like someone who gets chickenpox, all of a sudden when they're 70 years old gets shingles, which is far more painful than chickenpox was, but it runs from the same strain of virus. So if people are experiencing kidney issues and lung issues and liver issues and all these other vital organs are being adversely affected, and you think you've quote unquote beat this virus, it's still living in your body. Like there's no, even if you're asymptomatic, if this virus is living in your body, you don't know what it can do over the course of 10, 20, 30 years because there's trillions of cells in your body. That is a trillion opportunities every second of every day for this virus to figure out how to mutate and evolve. And if it's one thing that I'm worried about, people that are so cavalier about it now because the mortality rate's only 1%, or even if it's 0.5% or whatever, I mean, 1% of 300 million people is 3 million people. That's effectively that's the entire Bay Area disappearing.
Right.
Or at least a good it'd be like San Jose, San Francisco, and Oakland, all just falling off the face of the earth.
Right. Absolutely. Absolutely. It's too new. We don't know. All we can do is be educated about it and stay safe. But, the other thing that I was talking to my friend who lives in Israel, and there's a reason why America's become the epicenter, right? There's two reasons. One is
we're stupid.
We're stupid, but there's right, like, who is our quote unquote leader right now, right? It's become politically charged, where this is a public health issue. It didn't need to get to politics. That's reason number one. Reason number two is inbred in our very society. Americans are very much value their freedom and our individualism, versus other cultures are community based, right? It's not just me versus you or me and you. It's us. It's a collective effort, right? And that's why other countries are doing so much better. Most other countries are doing
One
so much
thing
better
that
than we are.
one thing that I've been lamenting and basically parroting and soapboxing to so many people is this notion that Americans are indoctrinated from such a young age that is all about taking care of yourself and
Right.
being an individual, but also somehow developing this deep bond to your national pride. But
Absolutely.
what is more nationally prideful than doing things to help your fellow American, right? Like if
Right.
America is supposed to be the great country that it is, and in a lot of ways it is, in a lot of ways it isn't, obviously.
Right.
But if the notion is, hey, America is great and we're supposed to make it even better, how can you do that if you don't value the life of someone next to you because it infringes on your
You're,
falsely perceived
yeah,
freedoms?
absolutely. Absolutely. So there's, we have to get down to the basics. And fortunately, people that are open-minded and, we're very fortunate to live in the Bay Area where it's incredibly liberal and we have pretty educated people here. But the rest of America, you've traveled across America.
But even
You've
here,
seen.
man, like I work in an essential industry, and
Yeah.
my God, people are the
Yeah.
opposite of progressive in so many
Right.
ways. They're complaining about all of the extra precautions that we are taking to ensure that not only we don't get sick, but they don't get sick. And they're seeing
Right.
it as an affront to their liberties. But in reality, they're totally conflating what their message is, right? They're saying, well, it's my right to not wear a mask. Like, well, it's also the business's right to tell you to piss off and not come in the store. But
Absolutely.
somehow they're thinking that they can just have carte blanche because they're American and they have the First Amendment
Right.
to do whatever they want, wherever they want. There is no such thing as blanketed freedom. Everything
No.
has stipulations, right? You can do
Everything has
whatever
a
you want.
price.
You can do whatever you want, but there is a
Yeah.
consequence for doing things that you
Absolutely.
shouldn't be doing.
So have you actually ran across some Karens and Kevins at your place of work?
Oh yeah,
Oh my God.
fucking absolutely.
That's awful, man.
Yeah,
I wish a Karen
so
would.
here's an interesting story. There was a lady that came in. She was talking about how she has horrible asthma. And then she said, well, I read this one article that said masks don't help with the transmission of this disease. So I looked at her and I was like, okay, well, when you get home today, and I straight up, like at work, I was like,
Yeah.
I want you to do an experiment when you get home. I want you to sneeze. I want you to sneeze once with the mask on and once with the mask off and tell me which time your hand gets more snot on it.
I love it.
And she looked at me
Good
like
job.
I said something so
Yeah.
astronomically incomprehensible that she was like, and she didn't respond and just walked out. But it's that sort of attitude that just is so it's permeated everywhere.
Right.
I don't think being in the liberal progressive Bay Area, I mean, we have
You're
one
right.
of the most hotbed areas in the entire United States. Like
Yeah.
pretty much every county in the Bay Area is on some version of lockdown because people don't want to fucking wear masks. They don't want to wear
You're right,
masks.
dude.
They don't want to social distance, and they basically thought a couple of weeks inside meant the virus is gone. That's not how this works.
Right. So I'm glad you brought up the mask thing. So my new job now is I work at an outpatient surgery center. So I help prepare people for surgeries and I take care of them afterwards when they're on anesthesia to make sure, they don't die. Well, we obviously have protocols where every patient, every nurse has to wear a mask. And this is in Fremont where it's maybe less progressive in a lot of ways I've seen. But I've had patients that are like, well, why do I have to wear a mask? Like, because it's just, to keep us safe and to keep all the other patients safe. This is just our protocol. You have to, or else we're not going to have you come in for surgery. So I remember this one lady who was arguing with me that, well, I mean, I wasn't trying to argue, but she's like, oh, I'll wear this mask for the procedure, but if I had to wear it all day, like I couldn't do it, like my oxygen levels. I'm like,
Oh my gosh.
but as a nurse, like especially in surgery, right, like we wear our masks for 8-12 hours a day. And look, I'm asthmatic, you know me, I have awful fucking asthma. Like if I got COVID, knock on wood, it'd be over. But I tried to explain to her that, look, let's do an experiment right now, and this is something that I've seen done, and it's the easiest way to dispel this train of thought.
No, your oxygen machine is fake news, man. It's not real. It was
Damn
preset. It was preset by
Yeah.
George Soros and the Democratic National Convention.
God damn it. That's all I got, man. That's all I got. But all in all, though, there's a lot of people that, like, especially after surgery, of course, yeah, you're high, I get it. But, you know, we put them on oxygen and they try to rip that shit off. I'm like, no, I get your high, man, but I'm going to put that back on and it's not gonna be pretty. But yeah, I guess that part's been a little scary. Just,
where do you think
where
do you think this disconnect has arisen from, where people suddenly, 30, 40 years ago, it was almost seen as though a doctor or a physician was seen as the gold standard for information?
Right.
Where the fuck did this change happen?
I mean, the obvious thing right now is our great fucking leader in charge, right? His followers will blindly follow anything he says, and he has discredited a physician, an incredibly intelligent physician. So it doesn't matter what he says anymore. I've read this article that, like, people that still support Trump, it's such a big part of their identity that if they think that he's wrong now, it would
shatter it would like shatter
identity, their ego, everything. So that doesn't matter. This is how Nazi Germany started, right? Like, this is your dictator. Nothing he says can be wrong. This is brainwashing. This is classic fucking Munchausen syndrome, right? Yeah, I think that's a big part of it, and it's terrifying because it's affecting everybody, unfortunately. It would be great if all the non-believers could just be in an island somewhere off of Florida.
We need both Dakotas. We can just reserve one entire Dakota for people who want to.
That'd be great. Why do we have two? We need one. Like, it's just so much
space. We can just turn one into an anti-vax, anti-5G, anti-science community. And they can go there with all their guns, for sure. Like, just go there, take your guns, bring your cattle, like, whatever you have, all your worldly possessions. Like, 95% of those states are empty anyways. We can just, you guys can all go there, and we'll just have a social experiment. The rest of us will wear masks until there's a vaccine, and then until the vaccine becomes a ubiquitous part of our identity, like, the MMR vaccine was supposed to be, until people stopped doing that, and then it broke out in like 5 states in the last 5 years. So,
amen. Yep. But it's, yes, that is our natural, like, emotional response to it, and we joke around with it, but I know you know me. We want to make sure that people are as informed as possible, and then they're going to argue as to whatever, and at some point it seems like a waste of breath, right? But in order to, like, want humanity to survive, we kind of want, like, all humanity to have a chance to survive, right? No matter how shitty somebody may be, it's all trauma-based thing, right? Like, life is trauma, and it doesn't make sense that somebody's an asshole because of it, but you understand that it's a big part of who they are, and it's all circle, right? So as much as possible, like, it's easy to fucking hate these people, and I get fucking angry. I live in Lake Merritt. I see people walking around the lake with no mask. I'm like, you fucking morons. Like, I want to roll down my window and yell at them, but it's stop traffic and I'll probably get my ass beat. So I don't, but
well, plus you live way too close to the lake. You couldn't hide very easily.
I could not. But it's a natural human response to get mad about it, and we should be mad about it, right? Like, they're fucking with our safety, our health, our fucking families, and our friends, right? But we want to try to get down to the roots of what their thought process is, and if we can't distill it, let's put them all on an island.
Well, I think I think the big problem with what you're saying, I think the real crux of the issue is that institutions like the NIH and all the other health related organizations that are telling us we should do this or shouldn't do that, they're effectively seen as an extension of the over oppressive government telling people what to do. And when the government itself is known to obfuscate facts and oftentimes weak stories that can be easily disproven or are subsequently disproven through the following actions that are unearthed. It creates this veil of uncertainty from people who already don't like authority, and now the authority that is the authority is lying to them.
It's telling them what to do, right?
So I think that's where a lot of this comes in, it's this distrust in the government, and rightfully so in some ways, because the government
Right.
has not done itself any favors with some of the shit that it's
Not
pulled.
the best track record. Yep.
Yeah, and I mean, it's not even just the Trump thing. It happened under Obama. It happened under like every previous president, going all the way back to the first one.
The beginnings. Yeah.
People are still people, and people have their reasons for lying or conflating facts or telling stories that may not be entirely true. And I think what that does is it ends up breeding this very large and ever-growing contingency of people that don't want to listen to authority because they believe the authority inherently has their worst interests at heart while serving their own best interests, right? So I think that's the big problem, is that over the last 20, 30 years, with all the advent of technology and people basically coming to find out that the government is in fact spying on us with the whole Edward Snowden reveal.
Yep.
It is a powder keg that creates distrust. And unfortunately, we are reaping the benefits of a government that hasn't always been truthful to us and has lied to us. And these institutions, even though, folks like you and doctors go through years and years and years of extra school studying these things because you want to inherently try and do some good in the world, being seen as a cog in the wheel for the oppressive government trying to tell people what to do with their lives, which is an unfortunate.
On their freedom too.
Yeah, it's unfortunate, but I commend you and all the doctors who keep trying anyways, oftentimes in insurmountable odds and against vehement denial of what the facts are actually telling you. All I can say is keep doing what you're doing, and hopefully with more information and people being willing to have these conversations, we can find ways to alleviate the problem and strive for more solutions.
I like that a lot. That makes me happy. We have to have faith, or else what the fuck are we doing? And I'm not talking about faith in God, but faith in each other. We have to. Otherwise, how are we humans, right?
Yep. Yana, I appreciate you taking the time at 11 a.m. on a Sunday morning when you could be doing literally anything else.
Literally sleeping.
Yeah, right. Well, I mean, considering the type of job that you have, sleep is probably the one thing that you need as much or more than anyone else outside of teachers.
That's very true. Thanks, Luca.
My best to you and your family. I will hopefully see you guys soon. Stay well.
You too. Bye.
See ya.
Bye.
We'll do this again soon. Take care.
Yes. Bye.